Hello, good evening. You are watching QTV. I am Ibrahim Obalde. We are back again on another edition of the program that is sponsored by the Ministry of Health. And we talk about vaccinations for the past weeks. And of course, I mean, vaccines were ruled across the country. And that was a very successful campaign according to the practitioners. And we are back again on another edition of this program. This time, this day, we bring you this special coverage. And like I said, I'm Ibrahim Balde. Di leen dalal si programme bi di leen del si nañ si seen programme wérgu yaram bi fii si QTV di waxtaanee loolu li nga xam ne moo nekk vaccines yoo xam ne yooyu la Ministry of Health doon joxe si dëkk bi waxtaan nañ ko ay semaines yu bëri ba vaccine campagne bi passé tey nag indil leen topic bu am solo mooy cervical cancer bi nga xam ne lu am solo la maa ngi ànd ak suma ay naataango si biir studio bi ku toog suma boor left hand side mooy Mbayang Jom. Mbayang, welcome.
Thank you, Balde. It's a pleasure being here again.
It's good to have you. We miss you. I mean, last week we were not on the program. Yes, yes. So
today we are back.
It's good to have you here. And I have a gentleman as well. Please introduce yourself.
Thank you very much, Mr. Balde and QTV, for inviting me. My name is Dr. Abdullah Keita. I'm a consultant gynecologist and obstetrician, and I work with Edward Francis Small Teaching Hospital. And I've been very passionate in preventing and managing cervical cancer. Thank you for inviting me.
And on the far right, we have one of our aunties. Please introduce yourself.
Thank you for having me. My name is Nima Trera, a retired nurse midwife, now working with Bundung Maternal and Child Health at the Safe Cancer Bundu.
All right, thank you. These are the people that I'll be sharing this platform with and will be also connecting to the general public. And for those of you listening to this program via Q Radio 103.3, thank you very much for always tuning in, and we'll open the line later. But Mbayang, before we proceed, let's talk about the whole vaccination campaign that just ended. Tell us about the success of this campaign.
The MR vaccination campaign was a success, of course. But then I am just saying a warm evening to all our viewers out there. I would also take the opportunity to welcome Dr. Abdullah Keita and also Auntie Nima Trera. He's a doctor at the Edward Francis Small Teaching Hospital, and Auntie Nima, of course, she had been a mentor. She is retired, but not very tired.
Oh, okay.
Yeah.
All right. Nice, nice.
She is very active, and she's been one of those nurses that really started cervical cancer screening in the Gambia, and also had trained a couple of healthcare workers to be doing cervical cancer screening across the length and breadth of the Gambia. So it is a pleasure having you both here. And then coming to the MR campaign, I would just say thank you to everybody that really had participated, because obviously it was a teamwork. Health, like we used to say, is not only one man's business, but everyone's business. So every person has to play their quota, and really it was played well, because we've registered a national coverage of 91%.
Oh, wow.
Yeah. But then still, in order to validate the 91% that was registered during the campaign, we are doing the post-campaign coverage survey. They started this week. And a few teams will be going to communities, and they will be going to EAs, enumeration areas, so that they still can help them achieve the survey we are intending to do, so that we can validate the 91%. So, and we equally can be using that across across the group, especially with WHO, because this is something that we also have to report internationally, what really happened after the campaign, where the admin coverage really very true. When we say 91, is it really a 91% across the length and breadth of the Gambia? So yet we're also telling everyone out there to really open their doors and welcome these teams once they get to your compound.
Okay.
And today I will not say much about the discussion which we've been talking about, which is the HPV, the human papilloma virus. Of course, I have my mentors here myself. So
yeah, so it will be important
we will allow them
at this point.
We will allow them because all along we were talking about the primary prevention of what is HPV, what is HPV, how can it be transmitted, what are some of the risk factors. But these people are the ones that are doing the screening.
And dealing with it directly.
Dealing with it directly. So anything that they say is to the best of their knowledge. So obviously today, I will really be having
so
the opportunity.
on that note, we will start with Doctor. And the topic that we'll be discussing is cervical cancer. Let's start with what cervical cancer is.
Okay. When you hear about cancer, it means cells that have started growing and the body cannot control them. And they grow and grow in the area and then go to the other area. Eventually, they go into a distance. But when we talk about the cervical cancer, it means cancer that grows at the womb, mouth of the womb. Cervix is the mouth of the womb. It's where the sperm goes into the uterus, and it's where the baby comes out of the uterus. So it's hidden somewhere in the vagina. Sorry for that, but I have to bring.
It's all right. Okay. It's all right.
Okay. So that is where the cancer starts. And what's the important thing about this cancer is it's a cancer that is very common, has been very common around the world. And since the time of around 1940s, just before 1940s, one Greek pathologist discovered a method called pap smear. And since then, Europe and the developing countries use that screening method to reduce the cervical cancer from being #1 cancer killer of women to #3 or #4. Gambia, we went into it eventually, but we went in late. Luckily, by the time we went in, new things have come up. Then it used to be the pap smear and colposcopy, but of recent last 10, 20 years, it was discovered that that cancer is caused by that virus called human papilloma virus. So when we discovered that one, then since it's caused by virus, then antiviral vaccine, HPV vaccine, can prevent it in teenagers. Those are 13 to 9. Those are the ones Bayan and the group will go and vaccinate.
Okay.
But the ones above that, who are already exposed through marriage, through sexual activities, they have to be screened so that we can catch the cancer at the earliest stage, before it even forms cancer. Once the cells started changing, we catch it. The good thing is the difference, the time interval between when the cells started changing and when the cancer is formed, it takes 15 to 20 years. So that's a very good window which is used around the world to catch these women. And once you catch them, the treatment is very simple. It's just one-day treatment. And it's very cheap. Compared to when you get a full cancer, full-blown cancer, it's very expensive anywhere you are, whether you are in Gambia, you are in Senegal, or you are in around the world. So the best cost-effective way of dealing with cancer is prevention. The first prevention is primary prevention. That is what Bayan and the others are doing, vaccination.
Okay.
The second prevention line is secondary prevention. That is, you get the virus, you get the early lesion, then we screen you. When we find the lesion, we treat you. So that is a beautiful thing about screening and treatment of cervical cancer. Both screening and treatment are very cheap. They are easy. Just you go to one clinic one day, you get screened. If you are positive, we call you and we treat you.
Okay.
Yes.
All right. Most people find these cancers as death sentence. So once you have it, I mean, it's more of a stigma, and you are reluctant to go and visit a healthcare facility for help. What do you have to tell them?
Well, what you say is in certain degree is true. Because what happens, majority of the people, when they come out to complain that they have cancer, it's usually advanced and it's late. So that's why in good number of women, or men, even men, it becomes a death sentence. However, if you catch it early, it's as curable as any other disease. It's even, in fact, easy to cure.
Okay.
Because sometimes we get something called cryotherapy. It's ice frozen, we put it there 10 minutes, it kills the cells. Another one is called thermal ablation.
Okay.
100 degrees, we put it around the cervix, it kills the cells. If those two cannot, then we take you to theater, we take another thing called loop, we do a cone, which is 1 day procedure. After that, we don't even spend the night in the hospital. But if all those things are missed, and until it advances, and why is it advanced? Because it grows in people's private part. So usually, because of the culture and awareness, majority of them will not come out and report it until it's advanced at such a time that they cannot manage it in the house.
So we'll come back to you. Let's engage our auntie here. Ñu ngi laa dalal si programme bi. Dégg nañ docteur lu mu fi wax about cervical cancer. Bëggoon nañ rek nga indi ay leeral si kàllaama wolof te ndaxte yéen a nekk di liggéey ak ñii yéen xam ngeen lum dee def ak naka ngeen ko mun a traité ba pare du sonal jigéen yoo xam ne ñu ngi ko amee.
baax na jërëjëf Balde Badna maa ngi nuyu ñi ma bokkal jotaay bi di leen santa di santa Ministry of Health si jéego yi ñu jël pour ñu ñëw fii QTV pour waxtaan ak jigéen yi nga xam ne ñu ngi ñoo déglu ci fànn boo xam ne cervical cancer dafa nekk loo xam ne mu ngi sonal jigéen yi si Gambia bi te dafa war a nekk loo xam ne waruta sonal jigéen yi ndax feebar boo xam ne dañ koo aar waruta rey kenn te soo gisee muy rey nit ñi xëj na seen xam-xam moom màccut si mbiri cervical cancer bi. cancer bi comme si sa laajte bi mooy feebar boo xam ne su ko jigéen bi amee dangaa tuur deret waaye dafa am mandarga yoo xam ne daf la koo jox balaa moo egga fi moo tuuree deret mandarga benn si mandarga yooyu jigéen yi dañ ko war a xam te dañ ko war a leeral man soo gisee ma bugg a wax si kaalaama olof wala si kaalaama soose ñi ñoo jëflanteel loolu lañ gën a dégga te li gën a miiti ci kaw gi la bare ba tax na ma bugg a leeral lan mooy cancer. cancer mooy feebar boo xam ne feebari tuur deret la nekkul nag ne feebar yëpp mooy feebari tuur deret li tax ñuy dee leeral foofu tam mooy soo ko leeralut jigéen ñi soo ne feebari tuur deret rek dañoo wax ne man léegi dee naa waaye am na yeneen feebar yoo xam ne bunti jureekaay bi mun na koo jànku wantel ngay tuur deret te fekka du feebari cancer bi cancer bi nag dafa am i mandarga may dee bugg a jigéen ñi toujours ñuy dee xam mandarga boobu benn si mandarga yooyu mooy sooy àndaa sa jëkkër mun ngaa am mitit loolu yëpp mu ngi laa woon mu ngi laa jox signal ndax soo ko amee comme ni ko docteur waxee mun naa raam diggante juróomi at ba fukki at ak juróom waaye man léeg-léeg dama dee wax ne déedéet cancer mun naa gaaw si ñenn ñi parce que léeg-léeg dafa des yow si sa body mechanism sa immunity sa hereditary sa personal hygiene sa level of naka nga toppatooyee sa boppa sa lekka sax sa dundin ndax feebari cancer bi dafa nekk loo xam ne dafa bugg a sukur te ñun si Gambia bi fii sukur dafa nekk loo xam ne dañ ko dee dundee torop
soppa nañ ko
waaw soppa nañ ko ba tax na man dama dee bugg a di leeral fànn yooyu ak ñan nga xam ne ñooñu ñooy ñi nga xam ne mun nañoo am feebari cancer bi mooy ñi nga xam ne ñu ngi dugga néegi góor dëgg la xale yi dinañ leen aar waaye xale yi ñoo aar tam dañ leen war a gën a bàyyi xel ñu bañ a teel a dugga néegi góor balaa ñoo am seen péngu yi ñakku yiñ leen dee jox ndax ñakku yi am naa si tuuti xam ne léegi diggante juróom-ñeneenti weer la ba dem si fukki at ak ñeneen te soo ko bàyyee xel ñun suñ Gambia bi fii ñu bari dañ dee sëy diggante fukki at ak ñeneent dem ba fukki at ak juróom benn kon feebari cancer bi dafa nekk loo xam ne feebari tuur deret la te fan la dee téye bunti jureekaay bi la dee téye naka lañ ko mun a saafaral nga dem si lopitaan bi ñu seet mandarga yi abnormal lesions lañ ko dee ooyee dafa am loo cee teg mu jox la mandarga te mandarga boobu dafa nekk loo xam ne jigéen bi si boppam du ko mun a gis du ko mun a xam fekk amul noos boo xam ne mooy ubbi bunti jureekaay bi wala docteur boo xam ne mooy ubbi bunti jureekaay bi mu def fa loolu muy faa def mu won ko ne lii mel na nii wala mënut naa naam mun ngaa see ak sa jëkkër nga am miitit ngay gis deret waaye fekka du cancer waaw waaye li gën a leer mooy nga dem feebari tuur deret boobu ñuy wax cancer ñu ràññee ko ñu seppi ko si feebari tuur deret bi pour ñu mun see jël yeneen jéego feebar bi fi moo téye si bunti jureekaay bi mooy comme ni ko docteur waxee mooy bunti seyukaay bi foofu la doom bi di jaaree te weer bu nekka foofu la jigéen bi dee gisee mbaaxam fa la fóot bi dee jaaree
am na solo lool ba léegi we'll come back to docteur Mbayang xam naa dinaa ñëw si yow waay dañ bëggoon rek ñoom ñu indi ay leeral yu bëri balaa ñoo ñëw si yow ba pare ñu ubbi tam line bi doctor, we just want to understand on a daily basis how many patients do you examine, I mean, and how many of them do you conclude, okay, I think she got this cervical cancer?
Okay, I work in gynecology clinic. Well, we take turns, doctors take turns. We have, but every day from Monday to Friday, there is usually a doctor. There are doctors and nurses, but we take turns. So usually the positive rate is usually 5 to 10%. That is for HPV. So if you have that HPV, the next line is you do colposcopy. If you do it this year, you don't have it, we take your number. 12 months later, we call you back to come and we repeat. Because when we do HPV, people who are infected with high-risk HPV, those are HPV 18, 16. There are some others, but these are the common ones. In the Gambia here, we've come to discover that 51 is very common here. So those women who get that HPV infection, those are the ones that are likely to have cancer. Okay. A small proportion will clear their virus, but some will proceed with their virus to become cancer. But you cannot say who will clear, who will not. So the women who get infected with that HPV, we follow them on annual basis. Okay. So once we do, if we call you this year, you don't have it, next year we call you. So it's once a year. So it's very convenient. It doesn't disturb you, this thing. And with that way, if we continue and follow, you are not likely to develop cancer. If you do, we'll catch it early and give you an effective treatment. Yes.
Okay. Interesting. Bayang, bugon nga yoka fufu. Communication bi si walum wergu yaram bi. Comme jigéen yu dee ñëw noos tam pour waxtaan ak gaay loolu tam dafa am solo dafa gën a jàppale pour ñu gën a mun a aware seen boppa ñu mun a xam ay mandarga yoo xam ne loolu mooy cervical cancer mandarga.
waaw mandarga yi daanaka docteur Keita anti ñi ma waxtaanee nañ ko te di nga gis ne beneen si mandarga bi moo di ne loolu li ñoo wax ne lii yëpp at the chronic stage lay happen because soo xoolee the cervical cancer itself wala HPV is asymptomatic symptômes yi yëpp su demee ba di ñëw xamal ne njaaxute am na comme léegi-léeg di nga gis jigéen bi tamit di toog rek di tooy da ngaa toog tooy xëy na suñ ko gisu tamit dañ koy dégga kii moom fu mu toog day tooy te tooyaay nga boobu tamit fekkoon ne xeeti ndox boobu sax neex na jàmma la waaye da ngaa gis ne léegi-léeg ndox bu am xet la borom di génne si biiram comme li ma conclude yëpp si li anti ñi ma wax ak docteur Keita moo di ne fu mu toll nii jigéen waruta dee si biir Gambia bi because of cervical cancer because benn primary treatment bang fa te vaccination is started here as a demonstration a piloted thing in 2014 2016 so from 2016 to date xale yooyu léegi tey mun naa laa wax ne ñeneen ñi sax mun naa am sëy nañ because so demoon soo jekkale school war ngaa mun a am 18 years soo jekkalut school tamit passé nañ 18 years jamono jini because we were catching them when they were 9 and we were vaccinating 9 to 13 years then. So last week from the 10th of this month nag vaccination si tamit are on te képp koo xam ne yaa ngi déglu programme bi si jamono bi ñun laa ñaax nga toog déglu ñu ndegem xam nañ ne borom du si jëlee dara su duwut wérgu yaram ak xam-xam ni mooy def boppam kon waajur yi bàyyi seen jànxasi ñu dem péngu ji te péngu yi jamono yi foo dem lopitaan yaa ngee péngu te dépense bi sax moo nekk loo xam ne doon na jafe-jafe waaye dépense bi su jafe wutoon di nga gis dinañ péngu daanaka loo xam ne passé na sax like 14 years we could have vaccinated from 9 to at least 25 pour ñoom yëpp ñu gis ne aaru nañ si li nga xam ne moo di cervical cancer te ñi nga xam ne ñu ngi dugal si néegu sëy benn yoon si juróomi at wala benn fan si juróomi at yaaxalul la dara jëlal say jéego dem si lopitaan bu la gën a jege foo dem fii cervical cancer screening is very free nga mun a xam whether you have the infection si teel ñu dogu ko su fekkee ne nag amuloo ko after every 5 years ñun like I read this text bu la ne do it twice if you are clear of the infection you don't even have to repeat it for the rest of your life kon loolu yaaxalut ni dara kon nañ jóg ñi nga xam ne duga nañ si néegu góor ñu dem defi screening bi ndik secondary treatment baa fa tamit kenn waruta mun a dee
dëgg la ba léegi ñu del si suñu anti lan mooy process bi screening bi lan jéego ngeen dee jël pour ngeen mun a screen nit ba xam ne kii moom amut lii wala am na ko ak soo leen defee screening tam ban façon treatment ngeen dee jël
waaw comme ma bantuwaat rek comme ni ko docteur Keita waxee woon wax na fi pap smear ak colposcopie waaye am na beneen test bu fi nekk boo xam ne boobu tubaab yaa ko ooyee VIA visual inspection with acetic acid loolu dañ ko isi pour low income country xam nga comme dëkk bu mel ni ki Gambia pour ñu mun a screen is almost equivalent to the pap smear because tuuti overview rek soo seetee bu njëkk bi Gambia fii jigéen ñi nga xam ne ñoo mun a dugga plane dem bitim réew def fa pap smear time boobu Gambia amu ko ñooñu ñoo rek am di opportunity pour ñu mun leen a seet ndax am nañ mandarga bi ndax amuñ mandarga bi ñuy ko dee def ñetti at bu nekk waaye bi visual inspection bi ñëwee with acetic acid mu nekk loo xam ne danga seet jigéen bi léegi in 3 minutes nga ne ko wàccal si lal bi amuloo ko te bagage yi nga ko jëfandikoo dafa yomba soo amee sa bagage si lopitaan yi liquide bi nga ko jëfandikoo foog naa boo génnee $50 di nga am liquide bi te liquide boobu mun naa seet lu dem ba si téeméeri jigéen liquide boobu bor bi sax ñu ngi koo jëfandikoo te xamuñ ne garab la kon mu ngi mel ni pour nga dem si lopitaan bi ñu seet la ñu gestu la ñu ne la am nga mandarga bi amuloo mandarga bi expenses bi yëpp soo génnee benn $100 parce que comme ni ko Mbayang waxee is free of charge te am na jamono joo xam ne wala bentey sax am na ñoo xam ne ñu ngi dem di fekk jigéen ñi ci kaw gi di leen seet kon dafa nekk loo xam ne dafa yomba torop pour nga dem si lopitaan bi lim im ko yëpp is less than $100.
less than 100 waaw loolu moom foog naa ne ku nekk war na moo taxaw ndaxte wérgu yaram no amount is small or big for health. Doctor, let's talk about the stages of this cervical cancer.
Yes, thank you. I'll come to the stage. But she raised something very important. That low-tech is called visual inspection under acetic acid. The liquid she is talking
The
liquid she is talking about is vinegar.
Oh, vinegar.
3 to 5%.
Oh.
If the cell is affected, you put the vinegar there. If the cell is affected, it will turn white. If it is not, it will turn pale. And I've trained almost close to 100 nurses around the country in a project that is sponsored by NASO. NASO is NASO is a French company, a French NGO from Luxembourg, and their counterpart in the Gambia is NASO, I think headed by, or the most active person is Aluba. So we've cooperated with them, with the hospital, and every year he will bring 25, 30 people, we train them.
Okay.
Nurses around the country. Then after that one, then your question, stages of cancer. The earliest stage of cancer, cervical cancer, is there is no symptom, virtually no symptom. You will not feel any pain, no bleeding. If it moves a little bit closer, you will see bleeding, but usually bleeding will happen what? If you have contact with your husband, after that one you will see bleeding. If that one persists, but there will be no pain. If that one persists, that's the best time you should go, because when they see it, it will be in an earlier stage. As it grows beyond that one, see, talk about water. That is when the water will start coming
out, yeah.
And it will be foul smelling. That even you yourself, you start feeling uncomfortable.
Yeah.
You start putting on pampers, start putting on perfumes because of that smell. And by that time, if you go to the hospital, it will be very difficult for it to be treated. When they start, it usually stays. The first stage is called stage 1, which is microscopic. It cannot be seen with naked eye. Okay. So, but it's only on the cervix. So stage 1 is divided into 1A, which is microscopic. 1B, you can see it, but it's still very small. So 1A and 1B, even if you go, luckily, we will be able to operate it. We can cut that area and remove it. Or if that's not possible, we can remove your uterus. But you'll survive and have a good quality of life. If it goes beyond that, it spread to the vagina, stage 2. So that's become big. Then stage 3, it goes to the lower vagina. It goes to the inside the pelvic. Those are a little bit technical.
Yeah.
But those are the stages when it will not be treated with operation. The treatment that can be done there is radiotherapy. There's a special machine that burns cancer. Unfortunately, we don't have it in the Gambia here. I've seen people who go out, spend $3 million, and they come back only to die of cancer. So it's very expensive. The unfortunate thing is the government is doing a lot for the country and giving them almost free health care. It's almost free. Because even if you say you pay, what do you pay? 10 or 25. So cross the border and go to Senegal. You'll see the difference. So people should appreciate and take that opportunity. That's a very good opportunity. Because if you go beyond, even beyond Senegal, I did my postgraduate training in Ghana. They have insurance, but even that insurance does not cover everything. Beyond certain limit, you have to pull it from your pocket. But fortunately, Gambia is still trying to give almost free health care to the populace. I know sometimes people complain. They ask me to pay this. But those ones compared to our neighboring country is very small. So those are the stages. First stage is stage in the cancer. A is you cannot see it with your naked eye. B, you can see it with your naked eye, but it's still small.
It's still small.
When they get it at that stage, it's treatable. But unfortunately, those are times that when they will either not go because they don't, or they think it's normal. Because the unfortunate thing, every month women menstruate, and the earliest signs of cancer is blood. So they are used to seeing
blood and thinking that's normal and it's going to cause the damage.
Or sometimes when you start your menstruation, until you finish, 2-3 weeks, you'll see bleeding in between your menstruation. That's another early sign.
Okay.
But by the time that water started coming, you started feeling pain, it's usually late. And that's the time when you will suffer. And unfortunately, if it is going to kill you, it doesn't kill you instantly. you can be suffering with it for 1 year, 1 year, 6 months, 2 years, before you eventually succumb to it. But as I will say it again, it's developed countries have managed almost eradicated, and it's not impossible to do it in the Gambia here, even with our little resources. That vinegar is very cheap. When you buy that 1 bottle of vinegar, with that low-tech screening, you can screen 100 people. What we do in Banjul is actually a little bit high-tech. It's a little bit sensitive, but even with this one, if you repeat it 1 year, 2 years, 3 years, the sensitivity is as good as the one we are doing in Banjul. So we train people all over the country so that everybody will have that opportunity, not only the people in Banjul or in Combos, but almost all the division, all the major health centers. You go there, you'll find somebody who can screen you for cervical cancer.
Okay.
So usually we start screening at the age of 25 and above.
Okay. 25 and above. 5050505. Ubineng line B. The line is now active. You can call and be part of this program. 5050505 if you have any question, and it will be answered. Mbokay Ubineng line B si 5050505. Budu number bu nekk si screen bi number yi ngena call pour bokk si programme bi. Dr. Kumayata Bake molbe cervical cancer ko kachaka fenne me yalonko natra itata juna pour que fan jibe abe makoy nolale isate mantoro natila nyato mo laftale yedo man nim fo mole ni cervical cancer ko.
Okay, Mr. Balda, baraka bake. Tonya cervical cancer sasalo mi ya ka musol le muta. Musol jama kabo sanyi mwani lulu kata santo. In fact, major jama bakatra sanyi tan saba, sanyi tan nan lulu, and sanyi ta wor. Aka wole muta. But muna na ka wole muta because na ni inin ke kafuta virus ikaf mi HPV 25 15 20 25 ibasuta di kabra diamo kumas ninti ba ko wala ko ya ka gelake sanyi tan lulu kata mo so 15 or 20 plus 20 will give you take you to 40 that is what all cancer ka funti
akana nga call soto lembe call tala nimbota je nga tenteng. Hello caller.
Ntala sa mo nyenga
Ha
Allah sa janyen do comme muso ka bleed nyame after menstruation. Sai ni bota mens kono 1 week. The following week da ma isa di yo ka bleed da wo ko kana mo the alfamu explain.
Iyo mbe jabila le yamo telefono e salandino. Okay. Dr. Yo
okay. Kumandula baraka bake la kumonga mwele. Kuro kola like lokum killing e yeloja. Ni waje fam bala istano loptan no soli wante doctor le jube. Abe kola la pour mo ka fo cancer long fam ka cancer. Aseke no cancer ba sasa jama kata gulu nya wala minisa o cause. Mine bo fibroid ni bleeding disorder soto or polyp all be sasa no. So, but feta loptan, doctor wanted no so a jube. Afeko nying a second of cancer or nying amanke cancer, ta ultrasound or ta blood test la. Komandula niamo wala munakumote. Niawa jeba ifama barek ta loptan. Eta no solely wanted doctor no jube.
Ni fenje ma min soute. Mbayang da nga bëggona ñu.
Bëggona sé yo ka def tuuti comme manam mandarga yiñ fe lim yépp waxuñ ne cervical cancer la waaye benn si mandarga yi la because feebar la yaa ngi gis daf dee mimique
mun ngaa dem fekka du loolu sax
mun naa dem fekka du loolu waaye duñ mun a toog rek xool la yow nit ki ne la am nga wala déedéet amuloo foog nga dem through some procedures pour ñu mun a xam laboratory procedures pour ñu mun a xam am nga wala amuloo soo amut lim doon tamit ba léegi dinañ la test pour xam ne lii la ñu faj la according to
waaw man sax lu ma
so dinañ ñaax mboolem jigéen si mandarga yi ku ko gis rek dawal nga dem testé lii nga xam ne moo di cervical cancer su fekkee du moom nga xam ne sa xol dina seet naka dina tëdda si fàllum boobu den nga dawaat beneen
soo demee sax bu nekkut loolu sax bu nekkee yaa ngi gis yoo xam ne xàmmeewuloo ko ñoom dinañ la mun a advice lan ak lan nga mun a def ba léegi rek bëggoon nañ ñu yokka si waxtaan bi about cervical cancer bi
waaw léegi cervical cancer bi man li ma ci bugg a yokka rek mooy na jigéen ñi buñ des gannaaw si seen wàllu wérgu yaram man loolu bugga naa ko ci yokka torop ba pare dama dee gis ngeen baalal ma waaye dama dee gis daf dee am benn weer rek comme si réew mi ñëpp dinañ jóg di wax cancer breast cancer cervical cancer xam nga cancer waaye man dama foog ndax fukki weer ak ñaar bi yëpp dafa war a nekk cancer prevention ba pare jigéen ñi seen ñaaka deelu gannaaw si seen wérgu yaram mooy bul xaar be nga tëdda wala be nga télé wala be nga gis lu la jaaxal mbaari muso ite miye kumandiroke ibe nyinin karola dokta ye jaabile jaabiro mu nyineti dron kana sifo ya batu ka yeloje kuru fulo tema ikuru fulol tema ika kuroje yelo ka sutiya wala ni ke ka kafu ka dimo kalamuta walanten ike fanganya wale ka jiyoje kana o batu ni barobe kende yari jato be kende yari ndu ni be futu wala kanidi ya soto je wo wato lem ila wuli wato ti yeta lopitano min suti yatel amunta sayin gambia itata lopitano wo lopitanto ibe nyin kura ngo kiskisila iba tar la jele isita ye koto fele ya jibe ni kura ngo taman seje sajara ni ma taman seje fanan ise kuwo min jeje ise wo jara docteur ya fo jang ala kumo kono amanke nyinti ko yele bon wo yele bon mu kansaleti je nyantanga je seneyandi falingo dobi je tubabol ka fay polip akatara wulu nyango bundato ni yele silo siyata woto ni ke kafutebe yelo jilal dobi je ka fay ko cervical erosion wala wulu nyango la busoti ni wulu nyango busita bake fo yele silol fintita ni ke kafuta ibe yelo jilal dobi je ka fay cervicitis ni wulu nyango yibuta beteke ikaje yele silol mini be wulu nyango bundato abe ka yibu nanay finti ni ke kafuta bayri futuo man toro min bije ibe yelo je nolal yo wol be mu fenulati mini ya lonko yele bon kuran wallem dum ayatara amanke kansati woto ka foko ibe la moy kanyim programme wala bila kuru fulo temo asutiyata nyonna yenyin kija faro soto ko atumando ba to kansale be la ko kumala ko tengol ya fo nyami kansa manke nyinti ko be sila suwo kono wala e kol ke dro ya fo ko hayeta man se min fo kansalem wala kansante bori yeta lopitano min sutiyatela no so ye jibe wala doktaro ye jibe nabe no so e santola asa fo yeta doktaro ya nabe doktaro fana e santola fana se mol kumandi ye jibe kansa e momo fa sa en gambia kono amunta ila ni misolem ka to fenne mi yalon ka se tankandi kuran odun amanyanna kamo lanjur yo pengo fana be kerin kuma la kote ngol ya fo nyami sanji konon to kata sanji tan nani dukare mbe musol be danila ani na suti yol ke mawol ngandi musol bula ye pengota isa yen tolbe silo min kono nyin jamano kono itel to bula la osira
call soto lembe kola nyintala hello kola
hello jawabana
nam
baldabana rada
yes how are you yes very good how is the evening
Alhamdulillah, it's fine.
Good.
I wanted to ask a question regarding the vinegar. He was talking about an experiment
yes
that we can held at home about the vinegar stuff, so it skipped my mind. That's why I wanted him to come back again.
Okay, all right. So they will make it very clear for you.
Okay, no problem.
All right, thank you. So, doctor?
Okay, thank you very much about that vinegar stuff. Yes, it's the same vinegar that you use in the house, but it's not experiment. It's a fact that has been established that vinegar has a second use, that at the hospitals and at the clinic and outreach, that it can be used to paint the cervix. And if your cervix has early cancer changes, that cervix will turn white. And your nurse or your doctor will tell you, you started having cell changes. So it's not experiment.
So you cannot.
But it's not. You cannot use it at home.
You can only. Okay.
The nurses and the doctors can only use it at the clinic, at the hospital, or at outreach, but not you yourself using it.
Okay, I think that's clear.
Yeah. It is a procedure.
And I think one thing I wanted to add also is the vinegar you are using is not only the vinegar, but is the vinegar with other hospital instruments. Like you have to use the speculum. And using the speculum, you cannot do it independently. It must be done by a trained personnel to view the cervix. And using the vinegar, you have to use either an orange stick with a cotton wool, or you use a forceps with a cotton wool.
Okay.
Yes.
Okay.
You swipe it, you give it 30 seconds to 1 minute, and then you read the test. So it cannot be done at home without a trained health personnel. We have to clarify that portion.
And it is also very important. Maybe probably you can mistakenly have somebody that will say, okay, I had them talk about vinegar. What I would do is I can use vinegar on my private part.
Yes.
So please, no one should try that. Because even the vinegar they're using is being diluted to an amount
3
that
to 5%.
and an ordinary person cannot do it.
Okay.
And the procedure is invasive.
It's important
and
for...
it is only for somebody that is well trained in it to really do it for you. So please, let's rush and go to our nearest health facilities and get ourselves screened. We are not asking anyone to do this.
So these vaccines, we want to understand these vaccines, what time should an individual take these vaccines?
Okay, you can take it any time of the year, any day, but the age is from 9 to 14. It used to be 13, now it's 14.
Okay.
But it used to be 3 shots, later reduced to 2. Now 1.
Oh, wow.
Yes. Because at the beginning it was experimental. But with the 3, they did a study and found that even the people who did 2, who had 2, had a good degree of protection. Then with 2, you can cover more people, especially in countries like the Gambia where we are donated.
Yeah, you should be able
with that 2, they discovered that people who have even had 1 shot had almost a similar level of protection.
Okay.
So now they say 1 shot for everybody.
For every individual. Yeah, so...
In addition to the when somebody should be having the vaccination. Okay, when it comes to the vaccination, like the immunization program, also some time back had this collaboration with the Ministry of Basic and Secondary Education, because we are having the intention of them having it into their year calendar, so that come every October or every November is going to be a HPV vaccination exercise that will be happening in school. But then we are also not forgetting those in the communities, those adolescent girls aged 9 to 14 that are not opportune to be in schools. What are we doing? We are doing the Bantaba approach to also get to them and also vaccinate them. But as of now, the vaccination is on from the 10th of this month to any other day that you want to be vaccinated outside the exercise. Just go to any closest health facility, ask for the HPV vaccine, and a dose will be given to you free of charge. Yeah,
so finally, we have just a few minutes to go. Doctor, your final, words.
Okay, so cervical cancer is a reality, but the good thing is preventable. And what we encourage for women is you don't even have to have a special day to go for screening. If you have a child and you are going to nurse to get the injection for your child, use that same opportunity to get the screening. Or you are going there for some other thing. So that that single day you can get 2 things at the same time. So if you get screened and you don't have it, you don't have to repeat it for maybe 3 years or 5 years, depending on the country's recommendation. And if you have it, it doesn't mean, if you have that early cell change, it's not death sentence. we have effective treatment, which is usually the one-day treatment. Thank you.
Thank you. Anti ñu tàggatoo quickly, time bi jeex na.
Mooy jërëjëf si programme bi ntenga min soto drombe min fola musole mini be jana musu konomal especially mini yalon koy katanos dukare mbal dani la musu konoma wo musu konoma ni wuluta fay dingo e kari saba soto muri la lopitano to e dingo soto dami yetaje ye wulu nyango bundaji be fama man toro soto ningaje comme ngan jibe nyin jibe ro mi nga fo via e ningake wulu nyango tubabol ka fo mi e preserve nka atankandile go tankandiro ka ke nyaadile docteur ya fo janne ka galaso kijelem wala ka jani ni yela nye sam marché to ni man la fila tabila ika frisle wala ya simbindi so amunta wulu nyango ka waleke o se tankandino kansala fo isi yodam
abarka mbayang quickly.
kansalu am la ñuy ñaax waajuru jamono yi ñu ngi péngu xale yu jigéen ñi kon nañ génnee suñ jànxay ndax ñu mun a am péngu yi ndik péngu yi mooy aar li nga xam ne moo di HPV infection bi na ñëpp képp koo xam ne dugg na si néegu sëy nag na dem defi screening bi is free of charge.
Thank you very much gentlemen and ladies for coming on the program. Lii lañ am tey si programme bi dinañ fi del si next week inshallah ñu waxtaane yeneen topic yu am solo suñ wàllum wér gu yaram kon jërë ngeen jëf.